of Chinese painters and Chinese physicians. The arts in China were nourished by the same naturalist and Taoist sensibility that fed Chinese philosophy and medicine. Chinese art attempts to express the ideas of balance, harmony, and change that are contained in yin-yang theory. In landscape painting, the harmonious spirit of nature is revealed through the depiction of a scene that depends on proportion and measure to create beauty. Wang Yun's mountain landscape is a traditional Chinese landscape painting. In it, the artist has captured the essence of nature as he sees it, in balance and in flux. The painting is like the Taoist symbol, containing yin and yang in their proper proportions, but constantly interacting and transforming into each other. The scene depicts a vast range of elements, from the towering mountain to the little trickling stream. Nature is shown as a balance of the yielding yin and the unyielding yang. There are the dynamic and the quiescent, the slow and the fast, the dark and the light, the solid and the liquid. All things contain both yin and yang. The water, for instance, is both yielding and dynamic. The picture is a totality, and each detail takes on meaning only insofar as it participates in the whole. The mountain is immense by virtue of its smaller foothills. The people are small by virtue of the vastness of nature. All things are imbued with interactive qualities and dynamics in their relationships to the things around them. Through a kind of poetic logic, the Chinese also think of the landscape painting as a microcosm of the universe. In it are contained all the elements of nature, and it serves as a model of the cosmic process. The landscape painter sees in a particular scene a unique configuration of the natural elements. His composition includes those elements or signs that are specific to a certain scene, but it also participates in the larger reality. The elements within the microcosm correspond to elements within the macrocosm. For example, winter is death, a budding tree is spring, a lake is all water, a person is humankind. The painting depicts a time and a place that, through their correspondence with the cosmos, become timeless and placeless. As the sinologist Franco Julian has noted, in China, the purpose of a painting is to rediscover the elemental and continuous course of the cosmic pulsation through the figurative representation of a landscape. The tension created by the correlation between the lines and the washes, the visible and invisible, fullness and emptiness, endows the landscape with the power to suggest more than the merely visible and open it to the life of the spirit. In a similar way, the Chinese think of each person as a cosmos in miniature. A person manifests the same patterns as does the painting or the universe. The yang or fire aspects of the person are the dynamic and transforming, while the yin or water aspects are the more yielding and nourishing. One person projects the heat and quickness of a summer fire. Another person resembles the quiescence and coolness of winter cold. A third replicates heaviness and moisture of dampness. A fourth has the shriveled appearance of a dry Chinese autumn. And many people display some aspects of the various seasons simultaneously. Harmony and health are the balanced interplay of these tendencies. In each person, as in every landscape, there are signs that, when balanced, define health or beauty. If the signs are out of balance, the person is ill or the painting does not work. So the Chinese physician looks at a patient the way a painter looks at a landscape. as a particular arrangement of being, behavior, interaction, and life science in which the essence of the whole can be seen. A person's characteristics, of course, are somewhat different from nature's signs, including color of face, expression of emotions, sensations of comfort or pain, feel of a pulse, moral fiber, but they express the texture of the human landscape. Is Chinese medicine an art? Is it science? If we mean by science the relatively recent intellectual and technological development in the West, Chinese medicine is not scientific. It is instead a pre-scientific tradition that has survived into the modern age and remains another way of doing things. But it does resemble science in that it is grounded in conscientious observation of phenomena, guided by a rational, logically consistent, and communicable thought process. It has a corpus of knowledge with standards of measurement that allow practitioners systematically to describe, diagnose, and treat illness. Its measurements, however, are not the linear, fixed yardsticks of weight, number, time, and volume used by modern science, but rather flexible images of the phenomenal world. Yet, Chinese medicine also demands the artistic sensitivity of synthetic logic, always aware that the whole defines the parts and that the pattern may transform the significance of any one measurement within it. What is in one person may be yang in another. Because it deals with situationally dependent images, Chinese medicine allows and demands a recognition and assessment of quality and context. This artistic sensitivity allows the physician to stay in touch with subtle refinements of meaning, to discern shades of significance in human and behavioral signs. But, most important, it allows awareness of the process that exists around and between linear measurements. Chinese medicine is not primarily quantitative. It recognizes that each person's pattern has a unique texture. Each image has an essential quality. The Chinese doctor's effort to recognize patterns within the characteristic signs of a particular individual is a creative one. But it is here that the concerns of the artist and the doctor begin to diverge. The artist uses his or her vision and skill to portray an ideal of balance and harmony on a paper scroll. The physician, however, uses his or her perception to recognize disharmony and must then apply his or her specialized skill to try to restore health, to achieve balance and harmony within a living organism. This balance is a dynamic equilibrium that is appropriate and specifically possible in the particular circumstance and the development phase of a person's life. There is no standard or absolute. What is health for one person may be sickness in another. There is no notion of normal in yang, only the unique challenges and possibilities of each human life. Hallowed tradition and modern research. It may be beautiful, but does it work? The traditional medicine can be considered an art, and it can claim to be a science. But the important question to ask about a medical practice is, does it work? Is Chinese medicine just an interesting philosophical curiosity, or is it a viable system of healing? Can it treat what the West defines as real disease? And can Western science measure its results and appreciate its value? Because of the unique history of modern China, traditional medicine has been the subject of comprehensive study and testing over the past 50 years. After the victory of the Chinese Revolution in 1949, the Chinese decided to take a fresh look at their traditional medicine system. Many of China's new leaders were tempted to discard their pre-scientific medical inheritance, along with other old-fashioned practices and remnants of underdevelopment. Their overall desire was to emulate the developed countries, to industrialize, electrify, and modernize. Another function of the leadership, however, saw that although China did need to accept modern medicine, there might also be some practical and theoretical usefulness in the traditional medicine. At least partially, the issue was whether or not it would prove efficacious from a modern perspective. To answer that question, the Chinese performed thousands of experiments and clinical studies during the 1950s. In 1958, for reasons that included scientific as well as cultural and economic concerns, the Central Committee decided to give traditional and modern medicine equal respect and place in China. The medical reports, which are used to support the official adoption of Chinese medicine, are still produced incessantly and include such titles as the following: Clinical analysis of 290 cases of chronic glomerular nephritis treated with traditional herbs. Observation of the efficacy of subcutaneous acupuncture in treating 121 cases of bronchial asthma. Study of treatment of early-stage cervical carcinoma with traditional Chinese herbs, including analysis of treatment effect on 24 cases and preliminary investigation of the treatment mechanism. Traditional Chinese medicine, medical treatment of angina pectoris, report of 112 cases. The pages of such studies fill entire libraries, yet it is not their quantity that is important, but rather their conclusions. From the modern Chinese perspective, traditional Chinese medicine can hold its own. It does work clinically. Even for thoroughly modernized Chinese medicine has come to be accepted as an effective healing method. It is now routine for Chinese to think that their traditional method can alleviate or treat illnesses for which modern medicine is not effective. At other times, the opposite is believed, especially in those cases that require surgery or interventions with high technology equipment. A partnership has evolved. For modern Western nations, the scientific judgment as to whether Chinese medicine is an effective therapeutic and should be integrated into mainstream medicine has not been as simple or unproblematic. In part, this problem is related to the fact that, until very recently, Chinese medical research has not adopted the modern methodological safeguards of the double-blind randomized controlled trial. Even simple control groups have been missing from most Chinese clinical studies. Recently, in an effort to demonstrate the value of traditional medicine to people outside China, a movement has begun to meet Western research standards. More important, Western researchers who would consider the Chinese investigations as preliminary evidence have begun to perform evaluation of Chinese medicine using modern scientific standards. Such outcomes as the National Institute of Health Consensus Development Conference of Acupuncture, with its positive assessment of the value of acupuncture for some clinical indications and a call for its incorporation into some conventional setting, demonstrate that this recent research has begun to change the status of Chinese medicine's scientific credibility in the West. For a detailed discussion on the scientific engagement in Western nations with traditional Chinese medicine, see Appendix E. Despite its shortcomings, Chinese scientific research is important in understanding how traditional Chinese medicine has come to be understood in modern China. This research also illustrates the provocative assertions Chinese medicine makes for its potential role as a vital component in a future global cosmopolitan medicine. A good example of such Chinese research is the previously mentioned study of ulcer patients. In that study, there were actually 65 patients, all of whom were observed by Western-trained physicians while being treated with traditional Chinese methods. Every patient received a complete Western medical examination and was diagnosed as having peptic ulcer disease. The patients were then sent to traditional physicians whose diagnosis roughly corresponded to the 6 different patterns described earlier. The Chinese doctors gave each patient a unique herbal treatment based on his or her particular diagnosis. No Western treatment was administered, nor were any dietary restrictions imposed. The average length of treatment was 2 months, and modern Western techniques were used to evaluate the treatment's utility. The results were complete recovery in 53 patients, which is 81.5%, significant improvement in 7 patients, which is 10.8%, some improvement in 2 patients, which is 3.1%, no change in 2 patients, and a worsening of the condition in 1 patient due to complications unrelated to the treatment. Another example is the angina study listed above. For that study, 112 patients with angina pectoris were treated and observed for 6 months to 2.5 years. All the patients were first given complete Western medical examinations and then diagnosed by traditional Chinese methods. In general, 1 of 5 distinct patterns was found in each case, and different herbs were prescribed for each pattern. Assessment of the therapy, based on subjective patients' findings, was as follows. 34.8% of the patients improved markedly. 56.2% showed general improvement, and 9% remained unchanged. The overall percentage of subjective improvement was 91%. There were 91 patients who had abdominal electrocardiograph reports before treatment. Of these, 15.4% showed marked improvement after treatment. 23.1% showed moderate improvement. 10.9% showed an increase to abnormal reports, and 50.6% showed no change. The most interesting results, however, were seen when the patient's blood was examined. The serum cholesterol and triglyceride levels had dropped markedly in all cases after treatment. Western medicine considered low level of these substances beneficial in reducing the threat of atherosclerotic heart disease. These changes occurred without dietary restrictions and without the use of modern drugs to lower the level of blood lipids before or after treatment. Obviously, for a Western scientific audience, the finding of this study and the previous ulcer study would only be considered preliminary data. In order for such results to be maximally persuasive, the outcomes would have needed to be compared to those of concurrent control groups assigned by some randomization procedure that were given an identical appearing placebo, with all subsequent clinical assessments performed without knowledge of treatment received. Nonetheless, such evidence is what the modern Chinese generally have accepted as convincing. Research, both in the East and in the West, has also been done to isolate effective components of particular Chinese medical treatments in dealing with disease are recognized by the West. For example, experiments have discovered the active ingredients of herbs and have tried to develop efficient nausea treatment using acupuncture. Many studies have attempted to extract from Chinese medicine new, Western-style cures. A sense of the direction of this research can be seen in such recent English-language scientific journal titles. Qinghosu, artemisinin, an anti-malarial drug from China. The effect of Chinese hepatoprotective medicines on experimental liver injury in mice. Inhibition of growth of human immunodeficiency virus in vitro by crude extracts of Chinese medicine herbs. Biologically active constituents of Centipede minima, sesquiterpens of potential anti-allergy activity. The effects of traditional anti-rheumatic herbal medicines on immune response cells. Such studies are aimed at separating out the effective components of Chinese medicine and introducing them into the framework of modern Western medicine. Someday, after much research and development, these components may well appear in Western medicine as practiced in the Occident. Yet, although this knowledge, with its use of traditional herbs and acupuncture, has a veneer of Chinese medicine, the actual application and methodology are clearly Western in orientation. The theory of yin and yang and the other traditional concepts are left behind. And while valuable techniques may be learned, the extraction of the practice from its theory calls into question the need for the traditional framework. Fortunately for its future, however, the results of the studies, at least from East Asia so far, generally demonstrate that traditional Chinese medicine does work best when left in the context of Chinese logic. In most cases, pattern weaving based on yin and theory produced better clinical results than the mechanical application of Chinese remedies within a Western context. The traditional medicine works not only because it has an effective arsenal of therapeutic devices, but also because it may know best how to use them. Western-style clinical studies of traditional Chinese medicine, by providing evidence for its practical effectiveness, have helped it win its battle for full recognition in 21st century East Asia. For the Chinese medical claims of efficacy to win acceptance within scientific circles in the West, more rigorous research will certainly be needed. Undoubtedly, ongoing and future research in Western nations will help clarify Chinese medicine's future in developing new cosmopolitan medicine.